So today's topic is debating language skill. First of all, let's discuss about critical analysis. So, what is critical analysis? Critical analysis is a part of critical thinking skills which involves other people's reasoning. This skill helps us to craft an overall argument in detail by identifying their reason and conclusion, analyzing how they select, combine, and other reasons to construct a line of reasoning, evaluating whether their reasons support the conclusion they draw, and evaluating whether their reasons are well-founded, based on a good evidence. Then, what is the positive and negative? In academic context, criticism refers to analysis of positive features as well as negative ones. It is important to identify strength and satisfactory aspects rather than just weakness, to evaluate what works as well as what doesn't. Good critical analysis account for why something is good or poor, why it works or fails. It is not enough merely to list good and bad points. Let's move to how to give opinion. Giving opinion is we say what we think, feel, or believe about something or somebody. There are at least 3 ways to give your opinion. First, you can express a strong opinion. Some people love and cannot stop themselves for expressing their opinion, which means they are certain of their mind and believe and express opinion strongly and frequently. And the second, we can express a neutral opinion. Some people may be careful when they ask to give their opinion. They confuse to take on which side. So, they prefer a neutral opinion instead. The last is we can express opinion subjectively. In this case, we can express our opinion based on ourselves, either our heart or experience. The next slide is about article review. So, what is article review? A piece of writing where you summarize and assess another person's article. There are 3 steps. The first, summary. In case to make the reader easier to understand, you need to make a brief summary. A brief summary doesn't mean you spoil the story. You can start to summarize it with the main concept, main conflict, main character, genre, and category. And then, the evaluation. In evaluation, we should evaluate as objectively as we can. It might contradict with opinion. We cannot be subjective in the evaluation, as our review will be a consideration for the other readers. We should give a decent evaluation, such as how the plot paces, the character development, the author writing style, and etc. And the last is conclusion. In conclusion, we conclude the story of the whole article and recommend which reader would love the article. In this part, you may give your opinion as well. So, in this slide, we will discuss about 5 steps for preparing a debate in the class. Step 1 is brainstorm the ideas. And then the second is organize the ideas. And the next is structure the speeches. What is structure the speeches? It is introduce the idea of the speech structure on the board. First, introduction, like who who are you and what do you stand for? And then preview, what are the names of the points you are going to cover? And then rebuttals. Unless you are the first speaker, you'd say, first, let's take a look at what we heard from the previous speaker and disagree with their point, of course. And the next is point 1. Now onto my point. Then explain the reason why is your point true and why does it mean your overall position is right. And then evidence like fake knowledge, example, imagery, or auditory to support your reasoning. Then, reminder. Remind the audience of the 3 points you have covered. And the last is vote for us. And step 4 is prepare your speeches. Introduce the idea of developing your argument by making them real. What is real? R. Reason. E. Evidence. A. Analysis. L. Is link. Choose the first speaker in each group and allow them some time to think about how to make each of their points real. Only allow them to write down 6 words for each point. In addition to the name, it's speaking and listening, not reading out. Choose the summary speaker and either a chair or timekeeper from each group. And the last step is prepare the rest of the class, which the first 3 speakers are preparing their speeches. First, the summary speakers need to think what they think the biggest issues in the debate will be. Their speech will focus on 3 big issues and show why their side has won those issues. And then the chairs, timekeeper, and any other people should try to win what the other side might say and come up with rebuttal.
We know when it comes to, we have been learning a lot for the past 18 months. And during this pandemic, some of us actually have been stuck at home, not doing much, and some have to go out. So for my outline presentation today, I will talk a little bit because we are talking about for elderly or older adults, or in Indonesia, we call it lansia. Even though I haven't been to Indonesia for quite some time now, I still have a little bit of Indonesian words that I still remember. So nutritional issues among older adults for my talk today, diet and lifestyle during pandemic, what we have and seen from other studies, obesity and sarcopenia, and then at the end will be updates and conclusion for my talk. So before we go and dive in related to COVID-19 and what do they do or affect us, there are several issues in relation to nutrition among older adults. First, definitely with our older adults, there can be malnutrition, under or overnutrition. There is not just about the weight, but also with micronutrient deficiencies, including anemia. When we are older adults, as we're growing old, there are physiological changes that happens to our body. There's some changes with your body composition, your muscles getting less, your body fat is becoming more, or both are becoming less. There's sarcopenia, obesity. There is some changes with your taste and smell, or for some of us, even though with hearing and eyesight. For those who are not wearing spectacles, by the age of 40, you start to realize that you need to have your spectacles, okay? So oral, it can be also compromised either via your poor oral health, your tooth loss, or dentures is not being fixed properly. And because you have so much of polypharmacy or medications, that might lead you also to xerostomia or dry mouth. So when you also have these changes, you don't feel like eating, despite the food is so good in front of you. Besides than that, there are some gastrointestinal changes. You might experience some dysphagia, or you might actually having less acid chloric produced from your gut, and constipation, and etc. This come either you are healthy older adults, as well as if you are already having some diseases. Then when you are facing all these challenges in your life, it might affect your quality of life. Thus, you start to see people becoming depressed, they are actually lost their spouse, they're becoming depressed, functionality, they're actually going to be less, frailty, so on and so forth. So have that at the back of our mind, let alone when we are being hit by the pandemic. So you can see how beautiful this is early. I just want to show with you, this is how it looked like back then, 11 March 2020, when only the red zones for COVID-19 is very little. But within a split second or split few months, you can see everything is red. All right. And then at the same time, from a dashboard, you can see most of the countries been affected with COVID-19. And then slowly the mortality has gone up as well. So what is known during this time? So what is known during this time, one of the best ways of public health strategies to prevent the pandemic is doing by quarantine and isolation. And definitely that has an effect to your diet and physical activity. So when you are less moving around, you are also trying to reduce the diffusion or infection to prevent the pandemic. What will happen? People tend to move around before. People start to feel depressed. And I know if you read from the newspapers, people start to hit each other for some of the family members. People becoming anxious because this is something that they cannot do, cannot go out. Some people actually release their anger to their family members and increase stress because some actually cannot get their job. And what will happen in terms of food? There are so many things happening in their life, let alone when it comes to food. They cannot move, they cannot get money. So obviously, and they will try to stock up all the food that is possible because they wouldn't be allowed to go out that often. So the food that is always available on the shelf are food that is high in sugar, less in fresh fruits and vegetables, definitely because even though the food that being produced, they cannot cross the border to be sent. And what will happen when you are becoming couch potato? Unhealthy lifestyle, when there is a tendency of reducing physical activity and some people are stressed, the consumption of alcohol going to be greater. So when you look into our obesity is one of the common problem as well, either from kids up until adults to older adults. And before it comes with the COVID-19, obesity has already compromised a little bit with your immune system as shown in the slides, let alone when the COVID-19 infection happen, it will increase in terms of your chronic inflammation. It will also make your immune system dysfunction, but as well as it will also make it in terms of your severity, a disease, or poor clinical outcome. And in fact, what has been noticed from a lot of publications, obesity itself has emerged as a novel risk factors for hospitalization and death due to COVID. And what will happen if you're having non-communicable diseases? Because you know when you're older adults, or even though just adults, you definitely will have any of these, either high blood pressure, diabetes, heart disease, so on and so forth. And what they notice, 1 in 5 people who are at risk, increased risk of severe COVID-19 should they become infected. So the severity is becoming even worse once you're actually having one of the non-communicable diseases. So let's look in terms of the eating habits and lifestyle changes during COVID-19. So obviously during this time, you wouldn't be able to do face-to-face survey, but due to the cannot do the face-to-face survey, so they did online. And this study is conducted in Italy, looking into from within less than 3 weeks. And what do they get from the respondents at that time? And I'm sure in Indonesia as well, during that time, March or April, people are keep on sending to fill up some of those questionnaire in Google form. And I guess more and more we will see publications from the pandemic itself. But just look into here, with these respondents, what do they say? Most of them perceive that they had gained weight during the lockdown. And most of them agree their fresh fish and fruits consumption has reduced because nobody's going out. There's no one going to, no fishermen's going out there to take the fish. So obviously the quantity will be less. And also the surprisingly, when it comes to the group aged 18 to 30 years old, have higher adherence to Mediterranean diet. So not all things are bad. So it is just apparently when they are going back to their house, they cannot do much. They get influenced as well with their what we call it traditional diet, which is good. But this is just to summarize what I mentioned just now. During quarantine and COVID-19, this is purely during quarantine, the diet quality has reduced. So when you reduce your fresh fruits and vegetables consumption, definitely you reduce in terms of your antioxidants taking, as well as food that is low in energy dense has been minimized. What will happen? Foods that have longer shelf life. And longer shelf life are they having higher in terms of sugar, higher in terms of sodium, and definitely higher in terms of trans fatty acid. So let's look into some other studies looking into the changes of diet quality during this COVID. And what do you notice? People cannot go out. So what they do is actually none of them eat breakfast outside so much. So in terms of money-wise, you are actually saving money if you are preparing the food, unless you order Grab Food or Food Panda on the time to come to the doorsteps. So nevertheless, so look into here, as an overall from baseline, people tend to eat outside a lot, but because of the COVID-19, it has reduced in terms of breakfast, people have reduced, and more people are actually eating at home, which is brilliant. And this is published from the work by Lamarck in Canada. So if you look, there's always two sides of the story. There are some changes, but it's up to us to also make some modifications to make it healthy if possible. And definitely, when in comparison to Indonesia, Indonesia is actually half in terms of the overweight populations compared to Malaysia. So Malaysia is always growing very well when it comes to overweight and obesity. And I guess I had shared these slides before, and I think the trend would be almost similar or even more now for Malaysian counterpart. I didn't put here for children. For children, we are Malaysian is number 2 after Brunei in terms of leading for overweight obesity. So I don't see much of Indonesian is actually in the top 3 ranking. So well done to the Indonesian colleague. So the most commonly used measure of overweight and obesity, we use it with the BMI cutoff point. And what is interesting to see, when you are 65 and older, there's a U-shaped relationship between BMI and mortality. It means that you cannot be too lean or you cannot be too overweight. You just need to be just right so that you will always be in the good health. So aging itself is associated with significant changes in body composition, but definitely when it comes to reduction in fat-free mass. So it means in a short way, I'm just going to say your muscle mass has reduced. Okay, so hence that is very crucial to look after your diet, especially not only just once you are 60 and above, but at any time of your life. So let's go through this. Sarcopenia obesity with aging is always an interplay between sarcopenia and obesity. Once you are aging and if you don't control your food, less physical activity, you are also increased in terms of your abdominal fat. But don't forget, once you increase your abdominal fat, you're not moving around, your muscle becoming weak, you start to lose your muscle, or we can put in a nutshell called sarcopenia, and you had decline in your physical activity and you reduce energy expenditure. So that going to affect in terms of your cardiometabolic diseases, potentially increase your mortality and increase your physical disability. So all those things are important. I just put it here as a snapshot to look at the body composition as an overall for our body, rather than just focusing on body weight and BMI. There's so many compartments in our body, and focusing would be fat-free mass is the one that we want to maintain to be greater and fat mass to be less. But this varies in terms of your what we call age as well as your sex. Obviously, for female, between less than 30%, but for men, it's actually less than 20%, between 15 to 20. So these would be some of the methods that people normally will use in terms of looking at the body compositions, no longer just looking into your BMI. But bear in mind, for public health purposes, BMI and waist circumference is still a good way of understanding whether we are over what we call it, to look at our risk factors. So I've converted my presentation just now. This is how it look like as an overall. Your bone and minerals is quite small here, but your skeletal muscle is there, but definitely easily be influenced, because the moment we reduce in terms of your physical activity and proper diet, this will be reduced and you will leach out a lot of your fluid that is attached to your skeletal muscles as well. So as a summary, before we go further, why muscle is important. So muscle is definitely important for our movement, because we cannot move with our weak muscle. And also preventing sarcopenia during elderly, or even though if you're older adults, is actually if you already start to show sarcopenia obesity, is also to delay it becoming even worse. Currently with our work, patients who are older adults who are going for surgery, we will make sure that if they are sarcopenic obesity, we will make sure that they will reduce weight before they go in surgery, and nutrition input and physical activity input. And that is currently happening in our hospital setup. So at the same time as well, predicts all-cause cardiovascular and cancer-related mortality. Okay, my slide is not moving. Let me see. There you go. Besides than that, I think by now, with the number of cases that we have, I think this is Prof. Noran is doing a wonderful study for Malaysian as well. But I'm just looking at some of the publications being done, some of the things that looking at when it comes to the COVID-19, is there an effect of long COVID? So especially for the older adult, it's very important because once you're having COVID, you are being hospitalized for quite some times. Once you're immobile and bed rest, and you will increase your inactivity. As a short term, you will see the reduction in muscle mass, reduction in your muscle strength, as well as you've always been fatigued and always have local and systemic inflammation. So you always feel pain everywhere. Thus, when you're looking into long term, I'm not discussing anything at all with the pharmaco treatment, but you can see because the treatment is needed for you to actually get better from COVID-19, this also will have an impact towards your muscle mass as well. So as a long term, if you're older adults, if you don't actually beefing up your body and as well as looking into your diet and physical activity properly, in the long run, you are accelerating your frailty, and you're also declining your functional capacity. So this would be require a lot more work for researchers to see, is there any possible intervention that we can do to make it better? So what are the evaluation of muscle mass and screening tool? So muscle mass normally we will use to look into using the computed tomography or MRI, or sometimes when we don't have those things, we just need to use validated tools that is called the screening tool for sarcopenia or SARC-F. Or sometimes for us who know or can use muscle strength as a simple measurement for hand grip strength, even though it's just focusing for the total body muscle strength on the upper abdominal, that is still good enough to give you some idea. So I don't have much information about muscle strength longitudinal study in Malaysia, but just sharing with you, even though from our work, we are looking from aging point of view in terms of those who are adolescents, what we notice, even though this group who are actually growing, if you don't give them enough in terms of the right micronutrients and protein and energy, you won't see much of increment of their muscle hand grip strength. So let alone you can see the boys is actually becoming stronger, but the male increment of muscle mass is actually not that great. By right, they should. But what we notice as well when we look into the determinants of it, higher protein and carbohydrate intake among males was associated with higher muscle strength, but not in females. But bear in mind, from our cohort, we have seen the female are actually not very active as they grow older. So what else we can learn from the hand grip strength? It is apparently hand grip strength also is a risk factors for type 2 diabetes. And let's see from this systematic review. And what do they see? From this systematic review, they're looking at the assessment from small effects, looking at if they are having diabetes and how's their hand grip strength. What they notice from the pool analysis, basically they are combining from all over the observational cohort studies. What they see is those who are having lower hand grip strength have a tendency or greater risk of developing type 2 diabetes. So let alone if you're doing a cohort study, don't forget to look into the hand grip strength of your participants. In addition to that, people normally will ask, but what would be the reference or the cutoff for hand grip strength? We never know whether we are not that strong or we are strong enough. So lucky enough, I think we are living in an era where a lot of publications has been out there. It's just a matter of us to check. So this is a good study done by this group, Pure Studies, looking into the prospective urban-rural epidemiological study, country representative from Southeast Asia up until South America, and they try to see what will be in terms of the strengths for certain age group and between comparison between female and male. And what do they see is Majority, if you're from the Europe, North America, you're a bit more stronger, but as you're going to Asian countries, we are a bit weaker. The reasons still need to be explored. However, it is very crucial when you are referring for the hand grip strengths, you must refer it not to the Caucasians, but refer it to your local context. And here, just a recap, if you're looking for Southeast Asia for us, even for female, if you can have 23, that is our average. So if you have your dominant hand is more than 23, you are a bit stronger. But as you grow older, you can see even though for men, from 40 to 37 and 33. And surprisingly, even though from our younger generation for female, some of it is actually already lower than the women who are within this age. So more work needs to be done in terms of health promotion and in terms of lifestyle changes. But I just put it here for those who are interested to do it, such studies for you guys to have a look at. But how about the nutrition in increasing muscle strength? So maybe I will give you the protein intake and exercise for optimal muscle function. And this is looking from this large group of Eastern group and led by Nick Hughes, who actually the professor in terms of kinesiology, looking into this. And definitely protein status got to do with factors that leads to lower protein intake, because older adults, your medical conditions, physical disability I mentioned earlier on, don't forget socioeconomic conditions. You used to work before, now you can't, unless if you have a good pension. Physiological changes I mentioned earlier on, or maybe potentially for some genetic predisposition. But you know, as you're growing older, you really need your higher protein needs, because some of disease-related protein catabolisms require that. If you're sarcopenic, you require that as well, and decreased muscle perfusion, and some of it can be with your anabolic resistance. So how much is you needed? Based on this review and based on this manuscripts or suggestions by the experts, older adults requires greater protein. I'm talking about healthy older adults. I'm not talking here about, I will talk a little bit when it comes to when you look into your kidney health, but this is a general healthy older adults, because older adults may also have decreased intake due to age-related appetite loss and medical conditions. And the optimum they recommend is between 1 to 1.5 grams per kilogram body weight. And don't forget, you cannot just do your thing when you're just focusing on food, but you also have to focus with exercise. Despite some studies have shown food plays a role, because 80% of it related to food and 20% has got to do with exercise. A resistance training is something that has been put more and more now, even though with WHO recommendations, and a combination of resistance training and adequate dietary protein, very important for this aging group. And with the recent paper, I'm not sure whether you have seen, in fact, you are not actually metabolic rate going to be reduced very much. In fact, your metabolic rate up until 60 years old are still really good. So please put aside your lame excuse such as our metabolic rate is going down. In fact, more and more studies showing that we are still doing fine up until the age of 60. So I put it there. So healthy older adults, we need about 1 to 1.2 grams of protein. And if you're actually having some undernutrition, acute or chronic, your requirements slightly higher, because you do have issues with some severe illnesses, or maybe you are doing some of the exercises. So when we talk about protein, some people are talking about, do we need certain types of amino acids? There are few papers working on it, but most of them have been worked in the critical illness. So they are looking at if you want to give a manipulation of leucine enriched, which is called EAA, or the beta hydroxy beta methyl butyrate, or we call it as a HMB. So what is HMB? It's a bioactive metabolite formed from decomposition of leucine and essential branched-chain amino acids, and these are required especially as part of the muscle protein anabolism. Just to make it life simple for all the audience, there's a study been done already with a randomized control trial looking into the intervention. Do you give them just a normal oral nutrition supplement with any type of protein, and an intervention group with another, what we call it, extra of this, not extra, so with the supplements as HMB. So what do they see is actually, when they assess it, at the end, from these 107 randomized patients in the intervention group and the control group, what do they notice? The concentrations of protein and vitamin D had increased more from those who are in the intervention group. So it is good. So if you're interested, please have a look at this paper. So diet enriched with HMB improves muscle mass and prevents the onset of sarcopenia. So if you are seeing some patients or you know that you are seeing some of the older adults and elderly, this may be applicable for your group. And in Malaysia now, I think the same with Malaysia, Indonesia, we do have some products now that is high, they promote it with high in HMB. But bear in mind, I don't have any working collaboration with that, but this is more for the for scientific purposes. Now, as I mentioned to you, we need more and more protein. Maybe some of us will start to think, oh, hang on, when you are looking at the protein intake, does it affect kidney? Yes, it will for those who are already having issues with kidney, if you're having diabetes and so on. But among healthy older adults with some of the studies, I'm using the one that is a systematic review, and they are looking into what we call the RCT as well. No conclusive evidence, either animal-based protein or plant-based protein, that are going to influence kidney health outcomes. So that's great, right? So the short-term higher protein intake, in fact, with your normal kidney function, look into your GFR, among healthy adults might actually give you some benefits. And rather than just concern about how it will affect your kidney, because sometimes the older adults, they don't actually have any problems with the kidney, but it's just like they don't eat that much. But the treated adults, or the diet quality has becoming less. There's some studies looking from longitudinally, if you increase your protein intake, there is an observation you are also minimized in terms of your frailty risk. Oh, hang on, that's really good. This is a study that has been done by the group of Carlo Jr. So what will be my take-home messages? Okay, so to make it short and sweet, nutritional factors is important, but it can't stand alone, as it still requires physical activity, and especially when you are also older adults during this time of COVID-19, a variety of food with high in antioxidants or make it preparation at home is very important. Definitely in terms of the diet quality is crucial for us to look into. And in order to achieve that, for you to move on or to move forward or to becoming more stronger, definitely not just the nutrition itself, you need experts from either the physicians, either from the physiotherapists, to give more input if you are already in a sick situation. Please also use your muscle. This will be another take-home message, because after all the works you have learned, maybe nowadays you can see more and more people are using online exercise, which is brilliant. Before this, we don't see that much, but people are now doing it. So it's coming back, looking at how you look at challenges as opportunity. That is very important. And then personalized and targeted approach. Despite my talk saying that you need more protein, you need certain things, you need more of this and that, it needs to be personalized, because if you are older adults with certain conditions, with certain diseases, definitely your requirements needs to be tailored according to your disease specific. And especially if you have kidney problems already with hypertension, your requirements may be slightly lesser, and you need to discuss with your team of nephrologists and also your dietitians there or nutritionists there on how much you can. So progressive and some resistant exercise is always good. So I would like to say, for the reflection for future intervention, when we are in the older life or lancia, we always look into the reflection when we are having our early life, because if we are not doing well from here, when we are reach this area, we should be also trying our best to minimize the loss or the problems. But if you are the one who are now the adults having your kids that to look after, or you are actually the one who are also pregnant and everything, there is a huge room of opportunity for you to make some changes, as these changes will also delay of your trajectory of the development of non-communicable diseases. So I know we are getting better now. I think everybody is going out, but increasing physical activity, whether you can do it, continue doing it either at home or at office, try to increase it. Unless if you have some pain at a knee joint pain, then you have to do some other exercise. Maybe some other less weight bearing exercise will be better for you. And as a researcher, as a people who are coming to this particular talk. What should we continue doing? So to ensure the populations continue to access and consume healthy diets, what we can convey messages to the governments, we also want to ensure that the food system and health system are intrinsically linked. Because I think with COVID-19, we learned a lot how this food system and healthcare system, sometimes it is not linked properly. And based on our experience with these 18 months, we should pick it up and try to give suggestions on how to make it better. Because I remember in Malaysia, there's a lot of fruits and vegetables that are actually been thrown away at the top of Genting, Cameron Highlands because it cannot reach Kuala Lumpur. Okay, things like that. Ensure healthy and affordable food is available for all. And this is actually going to be a challenge because as the economy is going to recover, certain healthy foods or even if certain foods has increased in terms of their price. In Malaysia itself, you won't get much of a chicken less than 40 ringgit for two. If you buy at the market now, it will be more. Okay. Continue advancing obesity and NCD prevention policies that are in development. And also you have to work collaboratively with your food industry and also to run the campaigns in terms of the food preparation in order to offer healthy and affordable food. And at the same time, as parents and as academicians and also as the students, you always have to be on alert, looking either from the policies or on the actions that you can take to ensure that we can get access to healthy diets and also ensure the policies are relating to healthy diets are still there. Because during these COVID-19 times, people tend to overlook because during the COVID-19, it's just enough for people to get enough food, but whatever the food's going in, it doesn't really matter. It is very crucial, even though from our work that I shared from our webinar before, we definitely see you need to modify because some of the foods that they give as to help this needy is very, very unhealthy. Okay, and that's about for me. Thank you very much. And I should stop sharing. I hope I'm on time, 40 minutes.